अपनी बात अपनों के साथ. Yes, I'm talking about UNICEF CACR forms Maharashtra Interfaith Alliance to fight health issues. An alliance which has come together for the mental well-being, health immunization, and anemia in adolescents. So come, let's take you to the press conference where you will know more about pilot campaign Apni Baat Apno Ke Saath.
My first question, of course, this is a good move. Interfaith Alliance for the adolescent, for our immunization and anemia part. You're taking care of the children. So, what would you like to say on this?
Yeah, I'm Nitin Wadhwani and I'm the founder director of the NGO Citizens Association for Child Rights. We have been working with UNICEF since 2017. We are a development partner. We've been working on programs related to water, sanitation, hygiene, menstrual hygiene. Focus area has been municipal schools. We worked in communities during the lockdown, especially community toilets
It's within Mumbai or within Maharashtra?
within Mumbai. We focused primarily on Mumbai and then also the healthcare facilities in Mumbai and all connected with the BMC. During the vaccination phase, of the COVID, we found that there was a lot of hesitancy, specifically in certain pockets and communities. And during that time, we had highlighted this point, and during the discussion, it came out that why not we take help from the faith-based organizations.
Why not working for humanity? Why considering faith? Because I think from the perspective of, from the general perspective, humanity is above all.
Absolutely, I do agree with you on this point that we should be talking about humanity. But we go step by step. We feel that this is again a pilot project, as I said, and we have experimented in the past because of COVID. So we thought, let us take it a step further. I wish that in the near future we will be talking about a humanity alliance, and not only restricted to faith-based. That's our plan.
And what sort of support you're looking from the government?
The government, we are working closely with the government with respect to the health facilities, healthcare facilities. We are also trying to reach out to the Anganwadis, because they are the people who are actually very close to the communities. They are, very well connected. I mean, the people know where is the healthcare facility. We are trying to become an interface, basically. Once we do the mapping, we are ultimately going to connect it to the respective government.
Say interface between an interfaith.
Interface between interfaith and also trying to help the government department, concerned department, to see how the impact can be much better than what it is right.
When we think about interfaiths, and on the other hand, we think about humanity. So, do you think that humanity should come first rather than doing it for interfaith?
So I agree with you. But seeing the ethos of the Indian citizens, we Indians are religious people and we try to sort of obey our religious leaders. And that is why I think it's important that religions sort of motivate people. They give an incentive to people because, as I said, we Indians say, oh, the spiritual leader has said it or God has said it, and therefore we have to do it. But on the other hand, I would agree with you.
Sir, considering today's India, which is more modern India, and the thinkings are changing, the political framework is changing, do you think that it would be leading India towards taking a decision that humanity would come first in the near future? Yes.
I would prefer that humanity comes first. Because if humanity comes first, then we don't divide our country into you are the follower of Hindus or I am a follower of Christians. But if humanity comes first, if the human person comes first, then I think the country can progress and the country can move forward.
Sir, lastly, any message, as you are a peace person yourself, so any message would you like to give the audience?
Yeah, so in this sort of thrust in working for the mental health of people and for the anemia for the children, I think we should leave aside all differences. I think the cause is important.
Ma'am, do you think that humanity is first rather than interfaiths?
यस मानवता सबसे पहला धर्म है ह्यूमैनिटी इज फर्स्ट
Ma'am, why there is a need of interfaith to connect for this particular thing?
why it is required because in India people are faith based, you can say religion based or faith based, they believe in that, and if they are told by those people who are following the same faith in which they come, they believe it very easily. Otherwise, this humanity is the first.
What is the hurdle coming? Like we have to connect all interfaiths to for especially working on the anemic and adolescent children's.
I don't think so. Uh, but we have to connect all the interface to tell the people or to go for survey. I think so. It is not necessary that we have to connect all the interface.
Ma'am, one liner.
Yeah.
What changes are you seeing in this global India now?
The changes which I am seeing in global India is people. If I say people have become more self-centered and demands are increasing a lot. Easy going life. थोड़ा काम करें ज़्यादा मिल जाए, something like that. Values, they are decreasing. I don't say कि there are no values are there, but still there is need to imbibe those values on certain level, and this can be taught only by your self example.